Good afternoon, everyone. Am I
Good
audible?
afternoon, ma'am.
See, today's topic is shocking. Have you heard about this? Anyone? What it is?
Yes, ma'am.
You heard, no? This is very common
Yes, ma'am.
in case of children or adult. Very common for children. Okay.
Children.
Yes. So, what is shocking? Shocking is a true medical emergency that required first appropriate action by anyone available. Emergency medical teams may not be arrive in time to save shocking person's life. When someone is shocking with a completely blocked airway, no oxygen can enter the lungs. You already know we used to inhale oxygen and we used to exhale carbon dioxide normally. So what happens when there is a shocking, it will be completely blocked airway. The brain is extremely sensitive to this lack of oxygen and begins to die within 4 to 6 minutes. It is during this time that first aid must take place. Irreversible brain death occurs in as little as 10 minutes. So within 10 minutes brain death will be there. So very first we have to take actions. We have to give first aid. Definition. Definition. Shocking is the obstruction of the flow of air from the environment into the lungs. Shocking prevents breathing and can be a partial or complete. With partial shocking, allowing some, although inadequate, flow of air into the lungs. Shocking is a blockage of the upper airway by food or other objects. It is shocking is obstruction of the airway. Okay, but how it obstruction take place? It may be due to food or other objects, which prevents a person from breathing effectively. Shocking can cause a simple coughing fit, but complete blockage of the airway may lead to death. If cough, then it's okay, it will come out. But if it is not cough, then it may lead to death. Done?
Ma'am, done.
Understand or not? Definition. Shocking is a blockage of the upper airway by food or other objects, which prevents a person from breathing effectively. Shocking can cause a simple coughing fit, but complete blockage of the airway may lead to death. Understand?
Yes, ma'am.
Next, what are shocking symptoms and sign? How will know the person is having? If person will cough, then it is okay. It will come out. But if person is not able to take breathe, then what we have to see? If an adult is shocking, you may observe the following behaviors. Number one, coughing or gagging. If person will cough, will know, then we'll give the what we used to do. If person will cough, what will do? What we used to do? Commonly, if somebody is taking, for example, you are taking water or anything, then after that you are having immediately coughing or gagging, what you used to do? From backside, what we used to do? Okay, like this. Coughing or gagging, hand signals and panic, sudden inability to talk, clutching the throat. The natural response to shocking is to with grab the throat with one or both hands. This is the universal shocking sign and way of telling people around you that you are shocking. Next is wheezing. Wheezing, you understand? There is a sound, wheezing sound. Those patients are having asthmatic problem. Those patients always they will be having wheezing. They are having difficulty in breathing, and that wheezing, that sound will be there. If you listen, I think you know during physical examination you must have learned this one. Wheezing sound. Passing out. Turning blue. Turning blue means that airway obstruction is there, so there is no oxygen. That's why it leads to cyanosis. If an infant is shocking, more attention must be paid to infant's behavior. They cannot be taught in the universal shocking sign. Difficulty breathing, weak cry, weak cough, or both. If they will cough very means they can cough strongly, cough will be strong, then definitely whatever it is blocked, it may come out. But the person will be not able to cough, then you will cry and not able to speak. Then it will be very danger. If it is an adult person, definitely the person can show the sign. Person can make the other person to understand what is his problem. Always we should tell, no, then we can show it. But for infant, it is difficult. They will not able to show it. So we have to give more attention to the infant's behavior. It's very common. We have to be very careful while giving feeding to the children, especially the infant. Infant means 1 year. Within 1 year, okay, we have to be very careful. The position we have to see, mainly the position and their swallowing reflex. They swallow or not, the things we have to see. We have to be very careful for infant and very common problems. So these are the signs and symptoms for shocking. So what first aid you have to do? Remain calm. Ask the victim if they can speak or breathe. If they can able to take breath, then you can leave them alone. If they cannot, then call for help immediately. If they are okay, then we'll leave them alone. They can take breath, it's okay. If they are not able to take breath, if they are unconscious, what we have to do? That one, I already told you to study CPR. So what we have to do, this is the position, tilt the victim's head and lift their chin. Apply pressure to the forehead to tilt the head back and lift the chin. This is for unconscious, if the person is unconscious. Next, this is for CPR, okay. First one you will be giving the position. Then second one, what you have to do, attempt to full breaths. I told you mouth to mouth breathe you have to give it. If person is unconscious, okay, remember that. Keep head tilt back and pinch the victim nose. We have to pinch the victim nose. Start, seal your lips tightly. Lips you have to seal tightly around their mouth and give 2 breaths for 1 and 1 to half second each. Allow chest to fully deflate between breaths. For COVID case, we cannot do, we have to use ambu bag. This mouth to mouth is not allowed for a present situation. Nose, that you have to completely seal it, and then you have to, with the lips, with your mouth, you have to seal it and give mouth to mouth breathe. You will be having practical class for this, okay. Check for breathing, you will be giving that, then after that you will be checked for breathing. Position yourself where you can look for chest movement, listen and feel with ear for breathing. Actually, this check for breathing you have to do before also, okay. Remember that. I told you that day, first what you have to do, you have to look, assess, listen, same time. Understand or not? That day I told you, no? This says check for breathing you have to do beforehand also, after that also. Clear or not? You understand what I
Yes,
said?
ma'am.
Yes, ma'am.
If they become unconscious, you will be giving this position. Now, before giving this position also, you have to check it. Look. First, what you will do in, if person is unconscious, I'll tell you. First, in the scene safety. That means person, if it is in danger situation, you have to immediately transfer to the safety place. Number 1. Number 2, remember, okay. Number 2, what you have to see, you have to call the person by name. See the response. Person is not responding. Then you have to call for help. But these things you have to do very fast, okay? Then you will be calling for help. Then same time, you will check the carotid pulse and check for chest movement. Pulse as well as your respiration, you have to check it. Understand? Yes? These
Yes,
things,
ma'am.
these things you have to do first. Then only you will go for mouth to mouth. Then you can see no pulse, no respiration. That also I took class for that. Then you have to go for mouth to mouth breath and chest compression. 2 mouth to mouth breath and 30 chest compression you have to give. Clear now? You will be having your CPR class. Then you will be knowing better. If victim is not breathing, give 5
Taught.
abdominal, anything.
Ma'am, CPR class has been taught already by Ma'am Adila.
It's taught already.
Ma'am, yesterday she taught.
Yesterday. Then these things I'll not take. I think she must have taken all this chest compression and all. Okay. So now we'll go to the to give rescue breath. That you know now. If person is unconscious, you have to do it. So now I'll tell only this one. For shocking, what the person is conscious, okay, but person is having not able to take breathe. What we have to do? This one commonly we are giving or not. We used to give backside blows. We used to give or not. You are eating some things. For example, you are drinking water. Somebody is talking. You also wanted to talk. Sometimes we used to have or not. Then we will cough immediately. Yes. Yes or
Yes,
no?
ma'am.
Or you never had
Yes,
experience
ma'am.
like that? So immediately we'll show the sign, then somebody will give blow from our back. Yes? Now you understand what I said? By seeing the pictures, you understand or not?
Yes, ma'am.
See, for this infant, can you able to see these pictures, no? Suppose, see, this is very common for infant, okay? We have to be very, very careful while feeding. For example, when the weaning start, weaning, you know, when the infant have completed the 6 month, till 6 month it will be exclusive breastfeeding. After the breastfeeding, even during breastfeeding also, mother have to be very, very careful. Okay, otherwise this shocking, it will lead to sudden infant death syndrome. That is very common. So we have to be very careful. So what happened after that? Suppose weaning started and the baby also will start taking food first time, or like that means they are not used to it. They'll be taking only the liquid from the this breast milk only. But once you start the weaning, we'll be giving little bit semi-solid type of food. So when you're introducing the food, we have to give the proper position to the infant. Okay, then we have to see the swallow. We have to see nicely they are swallowing or not, then only you can give for next one. So it's like very, very important and carefully we have to give feeding, otherwise this is very common, I told you. So once it happened, what we have to do? Suppose the baby wants to do, maybe he is feeling vomiting or coughing, so immediately we have to put, you have seen now forward, you have seen the infant how they are putting and giving the blow from the back side. So whatever it is going to obstruct the airway, it will come out. Got it? This is for infant and the children's. This is for adult person. If it is adult person, we have to take our hand like that. You understand or not? By seeing the picture now? That day I told you, no, I'll show you with the pictures. This one you understand how to do for adult.
Yes, ma'am.
Okay, so we have to hold like that so that whatever the foreign bodies or any objects or anything, food material, whatever is obstruct the airway, it will come out. Clear?
Yes, ma'am.
See this one. I am showing with the pictures. So complete blockage if the victim is unable to make the sound at all. Suppose the person is not able to make sound. Then we'll do. Then what we are not supposed to do, using your fingers to force out. We should not try ourselves to take out the objects, whatever it is. Then another things we should not do a lot. Do not thrust on pregnant lady on a very large size adult, or very large size adult or pregnant lady. We should not use the thrust. What we have to do? This abdominal thrust. Okay, this one. Stand behind the person who is sucking. This person is standing behind the person. Yes. Place your arms around the waist and bend them well forward. Bend them well forward. Glance your feet for and place it right above the person's navel. You can see now where they are putting their feet, where they are putting, I think you must have seen, above the belly button, navel, person's navel. Place your other hand on top. Thrust both hands backwards into the stomach with hard upward movement. You have to give abdominal thrust. Both the hands you will make it put above the navel and give a thrust. Then it will come out. Do it 5 times and then stop each cycle to check if the blockage has been cleared. Blockage is cleared or not. After giving this thrust, we have to check it, and we have to do it for 5 times. This will be one cycle. You will be giving, then just wait for some time, then again you give, then until and unless you will give 5 times and see the blockage is cleared or not. I think now you are clear about this. No, you understand or not? You tell me first.
Yes, ma'am.
Abdominal thrust, you understand or not? If you not understand, you see these pictures, no? How is to do for adult, how is to do for infant, how is to do for children. Clear?
Yes, ma'am.
Maintaining a clear airway is always the priority to make sure the person can keep breathing. Very important. Maintaining a clear airway is always the priority to make sure the person can keep breathing. It's called, see what it is called? Hamill's maneuver. How you used to do? You have to make the hands like this, and then we have to put above the navel and then you have to give the thrust, and that you have to do it for 5 times. That will be one cycle. This is the position. First, you have to stand behind the patient, make these hands, okay, how to make this one, and then you have to give this abdominal thrust. These are the steps. And for infant, this is for infant. Place the infant's stomach down across your forearm. Because infant is small, no? Across your forearm, you have to keep this position for the infant. Keep this position, and then give 5 thumps on the infant's back with a heel of your hand. With a heel, this is the for infant, with a heel of your hand you have to give. This is the position that you have to make for infant. If person is alone, then what we can do it? Place fist above navel while grasping first with other hand. With your other hand you can put it, and then leaning over a chair. If anything chair or whatever it is there, you can take help from them, from chair or anything, you can take help from the objects, and then drive your feet towards yourself with an upward thrust. It is same only, but if the person is not there, if you are alone, then what we have to do it. And this is for infant. I think you must have cleared now. This is the position you have to make beforehand, then you have to give this one, and this is for adult, this is for infant. This one, if suppose nobody is there in the office or somewhere, you are alone that time, so what you have to do it? You have to maintain the position, put your other hand above the navel, and with this one you have to give pressure so that if anything is there, it will come out. Understand or not something?
Yes, ma'am.
So if anything happen, can you give first aid now? Like this type of situation, you can give or not?
Yes, ma'am. Yes, ma'am.
See, again I am showing you the pictures. You have to give from your heel. If it is the infant, then only you have to give, but not very forcefully, okay? Because otherwise it will be a injury. Injury you will be giving, because infant is very small, no? They are only 1 year baby infant. And for children also same way, you have to give this blow, okay? This one you have to give it. Because especially for the chocolates and when they are taking, is very common now. Sometimes they are taking those, what to say, any other playing objects, okay? They will take, and they have the tendency to put it inside. So they will do it. Even coins also. Coins also, we have seen so many cases in, they have to go for even OT, okay? Because it's stuck there. So that's why it is airway obstructing. If those coins also sometimes playing time, they will be taking, and any objects like that type of things, because children, they don't know, no, what will happen. They don't know the danger. So they will be having, and that's why we have to give this blow immediately. You have to be very fast, okay, this one. And the same way for the adult. Adult, especially if we are eating something, food material, or maybe that time we are talking, or maybe sometimes we are drinking water, and then like that, which is very common, no? So we have to do this. Clear now? If the person is unconscious, then you can go for the this one, CPR. What CPR already ma'am has taken class, so I am not going more on that. So now you see what is shocking. Shocking is a true medical emergency that requires first appropriate action by anyone available. Emergency medical teams may not be arrive in time to save a shocking person's life. So you have to know it, how to save the person's life. That's why first aid, there is a, in your syllabus, there is a this one portion you have along with your nursing foundation, first aids, so that you can give immediate first care to the persons. Then when someone is shocking with a completely blocked airway, no oxygen can enter the lungs, the brain is extremely sensitive to this lack of oxygen and begins to die within 4 to 6 minutes. Within 4 to 6 minutes. It is during this time that first aid must take place. Irreversible brain death occurs in as little as 10 minutes. You have to be very, very fast. Definition. Shocking is the obstruction of the flow of air from the environment into the lungs. Shocking prevents breathing and can be a partial or complete, with partial shocking allowing some, although inadequate, flow air into the lung. Maybe some or maybe inadequate. Okay. Or sometimes it may be fully blocked. So shocking is a blockage of the upper airway by food or other objects which prevents a person from breathing effectively. Shocking can cause a simple coughing fit, but complete blockage of the airway may lead to death. This is very common, coughing. When we used to cuff it. This is way. But if it is complete blockage, the person it will lead to death. Then what are the sign symptoms? If an adult is talking, you may observe the following behavior: coughing, gagging, hand signals and panting, sudden inability to talk, clutching the throat. We will show the symptoms: wheezing, passing out, turning blue, that means cyanosis. If the infant is talking, we have to give more attention because they will not able to show the sign. They will be having difficulty breathing, weak cry, weak cough, or both. First aid, we have to remain calm. Ask the victim if they can speak or breathe. Try ask them to take breathe, or if they can breathe or they can speak, we can leave them alone. Okay. If they cannot, then we have to call for immediate help. Then you see the patient is unconscious. Then what you have to do? We have to go for CPR. Then after that, what you have to do? Mainly for shocking, this is for unconscious person only. If it is still it is there, what we have to do it? We have to give the from the back side a blow. We have to give it for children's, and for adult we have to give the abdominal thrust. That abdominal thrust, you have to know the position. You have to stand behind the patient, make your hands fixed and put in this one above the navel and give an abdominal thrust for 5 times. That is for one cycle, unless and until the blockage has been cleared or not. We have to check and we have to continue this. If it is not, then immediately we have to send through the hospital. I think you understand. Okay. Seer.
Yes, ma'am.
Who is Seer now? Not Sonu, no?
Ma'am,
Rosina.
Sadia.
Rosina. Okay. Taking the attendance.
Yes, ma'am.
Okay. Okay. Please take the attendance. Huh? You keep with you.
Okay, ma'am.
Today,
Okay, ma'am.
today, do you have any assignments from any other subjects?
Yes,
Any,
ma'am.
what is left? What is there?
Ma'am, nutrition. Nutrition.
Nutrition, what assignment?
Nutrition.
Ma'am,
No,
diet plan.
huh?
Diet plan for diabetic patient.
Okay, that one also you can do it. Okay. If you have anything pending work, you do that my period. Okay.
Yes, ma'am.
No, I just wanted to know the nutrition teacher, did she give you any other class, free class that to do that, or just she is giving you? She's not giving any free
Just
class.
giving us.
Huh?
No free class.
So you
No free class.
you do in my class today. Okay? Clear?
Yes. Yes, ma'am. Yes, ma'am.
Okay. Take care.
Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am.
Okay then. Bye bye. Huh?
Thank you, ma'am.
Welcome.